Welcome to today's episode of Serene Thoughts. We're diving into a topic that touches millions of lives, anxiety. It's something that affects nearly 1 in 5 adults in the U.S. alone, but how do we manage it? I'm here with Arjun, someone who's navigated anxiety firsthand. Arjun, how does it feel for you when anxiety strikes?
It's like this buzzing in my head, my heart races, and sometimes I feel like I can't catch my breath. It's hard when there's no clear reason behind it.
That's such an accurate description. Anxiety often feels like an overactive alarm system in the brain, signaling danger even when there's none. It can be overwhelming. What triggers your anxiety the most?
For me, it's definitely stress, work deadlines, big life changes. I notice it spikes in those moments.
Totally understandable. Studies show that many adults feel more anxious these days, especially due to things like economic concerns or global instability. But let's talk solutions. What are some practical ways we can manage anxiety?
I've found mindfulness meditation really helpful. It calms me down and brings me back to the present instead of spiraling into what ifs.
That's awesome. Research backs that up. Mindfulness works wonders for calming the brain's stress response. Another effective tool is cognitive behavioral therapy, or CBT, which helps us reframe negative thoughts. Like, instead of thinking, I'll fail this presentation, we can challenge it with, I've prepared well and done this before.
CBT sounds useful. I also heard exercise is a big one for anxiety. Anything to get the body moving, right?
Exactly. Exercise boosts endorphins and helps lower cortisol, which is linked to stress. Even a 10-minute walk can make a difference. Speaking of quick fixes, want to try a quick breathing exercise? It's called 4-7-8. Inhale for 4 seconds, hold for 7, and exhale for 8.
Let's do it. Inhale, hold, exhale. Wow, that already feels calming.
It's a game changer, right? Another tip I recommend is creating a worry time. Just set aside 15 minutes each day to focus on your anxious thoughts, then redirect your mind when they pop up outside that time.
I love that. It gives you control over your worries instead of letting them control you. And there's also the grounding technique, like naming 5 things you can see, 4 you can touch, 3 you can hear. It really brings you back to the present.
It's such a simple but effective tool. And of course, we can't forget sleep. Getting good rest is crucial. Anxiety and poor sleep often go hand in hand, creating a vicious cycle.
So true. I've noticed that myself. Speaking of which, we've got a viewer question from Lisa. She asks, how do I know if my anxiety is normal or if I need professional help?
Great question, Lisa. Normal anxiety tends to be temporary and linked to specific events, like a big presentation. But if your anxiety is persistent, excessive, or interferes with daily life, it might be time to seek professional help. A therapist can help assess whether you have an anxiety disorder and suggest treatments.
It's reassuring to know that it's okay to ask for help. You're not alone in this journey.
Absolutely. Asking for help is a sign of strength, not weakness. In fact, many people are seeking professional support these days, especially younger generations.
That's encouraging. So what resources can we share with our listeners?
There are some fantastic apps like Headspace or Calm for guided meditation. The Anxiety and Depression Association of America also has resources for finding therapists. And don't forget local support groups. Many of them are free and welcoming.
It's great that there are so many options out there. Preeti, any final thoughts?
Anxiety is absolutely manageable with the right tools. Be patient with yourself and remember, reaching out for support is always a good idea. You're not in this alone.
Thanks for joining us today. If you found this helpful, leave us a comment with your thoughts or anxiety tips. And don't forget to subscribe for more episodes.
Next time, we'll tackle stress in the workplace. Stay well.